Hello, my name is Faith, and I will be discussing functional programming in different areas like telemedicine, genomics, and health informatics. Functional programming is a programming language, or also can be called a programming paradigm, that avoids the mutation of data or duplication of data or even change of data that has been stored in a database or in a system. For this beginning topic, I will be discussing functional programming in health informatics. Functional programming is used largely in the health industry and in the healthcare industry, in hospitals and large health institutions, to store data and to keep personal and doctor information as well. Functional programming is used to keep and evaluate so much information that comes from customers, and that could be patient information, inpatient and outpatient information as much as possible, and that could also include some of the doctor's information that the doctor wants to store, some of the nurse's information which the nurses would like to store in the system, that could also be accessed later on by a doctor or even a different doctor in case a doctor is changed. And functional programming enables systems to keep and store data that will not be changed and does not allow mutation, as earlier mentioned, and this really ensures high sense of security with data that is very sensitive. And that, as we all know, healthcare information, when it comes to patients, for example, their medicine, that the dosage of medicine and the type of medicine that they will use cannot be changed because it's very sensitive information. So functional programming is used largely in such areas because it cannot be mutated or changed. Functional programming is used to create very complex databases that are still used in the healthcare system. As we know, the healthcare system has very large amounts of data that are stored in the databases, and for you to avoid and stay away from any sort of mistakes that could be made, functional programming is used for this complex and large amounts of data in the databases, and this ensures integrity and flexibility. And now I will talk about some of the advantages of using functional programming in health informatics. Some of the advantages is that data is very, very secure and it cannot be changed. And this ensures that whatever information that has been entered by one person cannot just be changed by a different person, which ensures integrity of data, and it ensures data is safe and can be kept for a long amount of time. Functional programming makes it very easy, or maybe simpler, to create databases as well, because once you create huge databases that store huge amounts of data, these databases are able to keep this data as well as protect it from any change without any specific or advanced authorization. Some of the disadvantages, however, of functional programming include the fact that it requires concept changes away from the normal and traditional programming languages that so many programmers and so many codes writers are used to, which can include maybe Java or C# or Python. And these are very common languages, but it requires concept changes from traditional programming languages. One of the other disadvantages is that it becomes very difficult for users who are also accustomed to other programming and traditional programming languages like Python. It's very hard and might be quite difficult for developers to get accustomed and to get used to a new programming language compared to what they're already used to. Some of the uses in the current day are the constructing and keeping of very strong EHR systems. And EHR basically means electronic health records, which basically is the amount of records and very huge amounts of data that are kept in the healthcare system. This includes data for patients, as mentioned earlier. It could be their personal information about their relatives or their family members, of even the medicine that they require, and they maybe new medicine that has been allocated to them by the doctors or nurses. As we have seen, functional programming is used largely in the healthcare system and in health informatics, and that is my presentation. Thank you.